Good afternoon. My name is Yiro Pan. Today, I'm going to present my project, which is related to improve unpaired image-to-image translation for Desmoking in laparoscopic surgery. So recently, robotic-assisted laparoscopic surgery has become the trend in medicine, thanks to its convenience and no risk of infection against traditional open surgery. However, the visibility during these procedures may seriously be affected due to electro-cauterisation, which generates smoke in the operating cavity. So this decreases visibility and hinders the procedural time and surgical performance. So recent deep learning-based techniques have shown the potential for smoke removal, but few targets laparoscopic videos. Therefore, we propose DeSmoke-LAP, a new method for removing smoke from real robotic laparoscopic videos, and the proposed method is based on CycleGAN, the Unpaired image-to-image cycle-consistent generated adversarial network, and is enhanced with two normal loss functions in our model. So one is interchannel discrepancy, and the other focus on the dark channel pirate. So they are integrated to handle various degrees of smoke while maintaining the true semantics and illumination of scenes. Besides, we contribute an unpaired realistic laparoscopic surgery dataset for the research. So in details, our proposed method is built based on the structure of CycleGAN model, which helps to sense the differences between an unpaired dataset and a skewed translation between these two domains. So in this model, we focus on two groups of data. One is hazy image and the other is a clear image. So there are also two generators and discriminator used in the model. So the generator synthesizes examples realistic in love, then to through the discriminator, while the discriminator aims to correctly distinguish between the real one and synthetic image. And also, it applies the generated adversarial loss and cycle consistent loss in the model before. So the adversarial loss measures the relation between the translated image from one domain to the real sample in the other domain. And the cycle consistent loss assess the differences between the real data in one domain and the data that translated forward and back to the original domain. So in order to further investigate the smoke component, we implement two additional loss functions to further experiment. So the interchannel losses is applied to measure the differences between any two channels of a pixel in the image, and a small value is obtained when there's heavy smoke covered on that pixel. So sample frames here present the effect by our impediment losses. And on the otherwise, the dark channel losses calculates the intensity of this image and reveals its illumination density, which is defined at the minimum value in the RGB channels. So the sample frames here compare the model that before and after implement the dark channel losses. So for evaluation and experiment, we organize the dataset from 10 surgery videos. So 300 clear and 300 image are output from per video, and to build the dataset. And we also utilize a sequence of 50 frames per videos in order to get a video clip for the further evaluation. And the dataset now can be accessed on our website. So we, for the experiment, we applied 5-fold cross-validation among these 10 video groups, and we complete quantitative and qualitative evaluation with these 4 existing Desmoking methods. And we also apply referenceless matrix in the evaluation, and user study has also been included with surgeons for further validation. So these are 3 referenceless metrics used in our research, since all our data are unpaired and connected from real robotic surgery. Ground truth image are not available. Therefore, the metrics commonly used, such as the peak signal to noise ratio or the structural similarity index measure, are not applicable in our project. Thus, we can only rely on the referenceless matrix. So the frog-aware density evaluator here can compute the frog density of the image. So a higher value means there are lots of frogs still covered on the image. And just noticeable blur matrix measure the perceptual sharpness of the image, and lower value means there's less sharpness of the image. And also the restoring edge assessment assess the edge restoration of the image, and a higher value means there's better restoration after the progress. So so now we look at the quantitative comparison. From the table, we can learn that colorless method achieve overall best performance by referenceless matrix when the proposed method outputs fine results compared to other approaches. Referenceless matrices are designed from, in our opinion, they are designed from the natural image, which are largely different from surgical image. So these are not be true indicated of surgical image quality. So therefore, we also have to rely on the qualitative comparison. We can see so we have to also rely on the qualitative comparison. We can see from the sample here, extend method encounter issue while dealing with the smoke covered on the corner, and they did less on maintaining details, but also the quality of the data. Thus, therefore, we expected that our method present better achievement in visualization. Besides, we complete a user study to assess the opinions by surgeons, and they were asked to rate video clips in whether the smoke is removed completely or the video quality is not degraded. So the figure here shows that all 3 surgeons participants rankings are comparable for all 5 methods and are in agreement each in the other. And it indicates that our method received higher score in both top statements. So this table concludes the ranking of the experimental comparison, including the results of the user study, and the our proposed method shows its strength in removing partial smoke on the image in both quantitative and qualitative comparison, and participants satisfied with the achievement of the proposed method. So in conclusion, we propose a method for virtually removing smoke in laparoscopic surgery for solving the visibility problem occurs during robot-assisted surgery. And unlike existing image dehazing method, DeSmoke-LAP does not rely on synthetic paired data and automatic scattering model. Instead, we introduce 2 additional lossy functions that assist to estimate the remaining smoke in the generated image by interchannel discrepancy and the dark channel pivot. So, and our method present outstanding result in comparison with existing approaches quantitatively and qualitatively when receiving agreements in the user study as well. So we also contribute an unpaired dataset for experiment use for surgery data. So for the future work, it will include the rows maintaining the original resolution of the laparoscopic video to obtain high quality DeSmoke image that will be beneficial for clinical use, and the use of large dataset for further improving the method's robustness. So it's also required to work on reducing the operation time and minimize the real-time delay in order to be applied in the practical operation. So this is all about our project today, and our dataset is available via this QR code, and feel free to access it. And also, if you have any question, please feel free to contact me by the emails. And thank you very much again for listening.